Vitamins are any of various fat soluble or water soluble organic substances essential in minute amounts for normal growth and activity of body and obtained naturally from plant and animal foods. Vitamin like compounds are a number of compounds whose nutritional requirements exist at specific periods of development, particularly neonatal development and periods of rapid growth. Antivitamins are substances that prevent vitamins from exerting their typical metabolic effects. Coenzymes are non protein organic substances that usually contain a vitamin or mineral and combines with a specific apoenzyme to form an active enzyme system. Anti-enzymes are agents, especially an inhibitory enzymes or an antibodies to enzymes that retard, inhibit, or destroy enzymatic activity. Hypovitaminosis is an insufficiency of one or more essential vitamins. This consideration is true. Hypervitaminosis is any of various abnormal conditions in which the physiological effect of vitamin is produced to a physiological degree by excessive intake of the vitamin. This consideration is true. Select a fat soluble vitamin, that is tocopherol. Select a water soluble vitamin, that is vitamin B1. Which of the following vitamins can be also synthesized from a dietary precursor, that is vitamin A? Which of the following vitamins resembles with hormone, that is vitamin D? Beriberi is caused by the deficiency of thiamine. Beriberi is a disease caused by deficiency of thiamine, endemic in Eastern and Southern Asia, and characterized by neurological symptoms, cardiovascular abnormalities, and edema. Deficiency symptoms of riboflavin is cheilitis, inflammation of the lips or of lip with redness and the production of fissures radiating from the angles to the mouth. Chelosis, a disorder of the lips characterized by fissure, especially in the corners of the mouth. Angular stomatitis associated with a wrinkled and fissured epithelium that does not involve the mucosa. All of the following statements concerning with vitamin A functions are true except acts as a hormone involved in regulation of calcium and phosphorus homeostasis. Deficiency symptom of vitamin A is night blindness, lessened ability to see in dim light, xerophthalmia and keratomalacia, various epithelial tissue defects leading to decreased resistance to infective diseases, male and female infertility. Xerophthalmia is extreme dryness of the conjunctiva resulting from a disease localized in the eye or from systemic deficiency of vitamin A. Keratomalacia is a condition usually in children with vitamin A deficiency characterized by softening and subsequent ulceration and perforation of the cornea. Night blindness is a condition of the eyes in which vision is normal in daylight or other strong light but is abnormally weak or completely lost at night or in dim light, and that results from vitamin A deficiency. All of the following statements concerning vitamin E functions are true except specifically required for synthesis of prothrombin and several other clotting factors. Which of the following statements concerning vitamin B1 functions are true? An essential coenzyme for oxidative decarboxylate of alpha keto acids, most important being conversion of pyruvate to acetyl coenzyme. All of the following statements concerning vitamin B2 functions are true except an essential coenzyme for oxidative decarboxylase of alpha keto acids, most important being conversion of pyruvate to acetyl coenzyme. Which of the following statements concerning vitamin PP, that is B3 or niacin, functions are true? Active group of the coenzyme nicotinamide adenine dinucleotide and NADP. Which of the following statements concerning pyridoxine functions are true? Active functional form is pyridoxal phosphate, which is an essential coenzyme for transamination and decarboxylation of amino acids in more than 50 different enzyme systems. Which of the following statements concerning pantothenic acid functions are true? Essential constituent of coenzyme A, the important coenzyme for acyl transfer in the TCA cycle and de novo fatty acid synthesis. Which of the following statements concerning biotin functions are true? Coenzyme for several reactions involving CO2 fixation into various compounds, for example, acetyl coenzyme to malonyl coenzyme, initial step in de novo fatty acid synthesis, propionyl coenzyme to methyl malonyl coenzyme, and pyruvate to oxaloacetate. Which of the following statements concerning vitamin B12 functions are true? Coenzyme for numerous metabolic reactions including transformation of methyl malonyl coenzyme to succinyl coenzyme in the metabolism of propionate. DNA synthesis, transmethylation, for example methionine synthesis from homocysteine. Which of the following statements concerning folic acid functions are true? Carrier of one carbon group that are added to or removed from metabolites such as histidine, serine, methionine, and purines. Which of the following statements concerning vitamin C functions are true? Has antioxidant properties and is required for various hydroxylation reactions, for example, proline to hydroxyproline for collagen synthesis. Dermatitis, diarrhea, and dementia are characteristics of pellagra. Pellagra is a disease caused by a deficiency of niacin in the diet and characterized by skin eruptions, digestive and nervous system disturbances, and eventual mental deterioration. Pernicious anemia is a severe form of anemia most often affecting elderly adults caused by a failure of the stomach to absorb vitamin B12 and characterized by abnormally large red blood cells, GI disturbances, and lesions of the spinal cord. Rickets is a deficiency disease resulting from a lack of vitamin D or calcium and from insufficient exposure to sunlight, characterized by defective bone growth and occurring chiefly in children. Scurvy is a disease caused by deficiency of vitamin C and characterized by spongy bleeding gums, bleeding under the skin, and weakness. Which of the following vitamins is given along with isoniazid in the treatment of tuberculosis? Pyridoxine. Which of the following vitamins is also known as an anti-sterility factor? Vitamin E. Mega doses of which vitamin are sometimes beneficial viral respiratory infections? Vitamin, which one? Don't know. Which of the following vitamins improves megaloblast anemia but does not protect the neurological manifestations of pernicious anemia? That is vitamin B12. Which vitamin enhances the anticoagulant property of coumarins? This statement is false. Loosening of teeth, gingivitis, and hemorrhage occur in the deficiency of vitamin C. Ingestion of polar bear liver may cause acute poisoning of vitamin A. Which of the following antivitamins prevent a vitamin B6 from exerting its typical metabolic effects? Isoniazid, ethanol, and carbamazepine. Which of the following antivitamins prevent a vitamin A from exerting its typical metabolic effects? That is lipooxidase. Which of the following antivitamins prevent a vitamin K from exerting its typical metabolic effects? That is cholestyramine, coumarins, and antibiotics. Which of the following coenzymes is of vitamin A origin? That is pyridoxal 5 phosphate. Which of the following coenzymes is not of vitamin A origin? That is coenzyme Q10, magnesium and carnitine. These substances are vitamin-like compounds except vitamin PP. Which of the following substances is vitamin-like compound? That is taurine. Which of the following anti-enzymes is a proteolysis inhibitor? Contrical. Which of the following anti-enzymes is a beta-lactamase inhibitor? Clavulanic acid, sulbactam and tazobactam. Which of the following anti-enzymes is a fibrinolysis inhibitor? That is aminocaptoic acid. Which of the following anti-enzymes is an aldehyde dehydrogenase inhibitor? That is disulfiram. Which of the following anti-enzymes is a cholinesterase inhibitor? Physostigmine. Which of the following anti-enzymes is a monoamine oxidase inhibitor? Selegiline. Which of the following anti-enzymes is a carbonic anhydrase inhibitor? That is acetazolamide. Which of the following anti-enzyme is a xanthine oxidase inhibitor? Allopurinol. Which of the following anti-enzymes is an aromatase inhibitor used in cancer therapy? Aminoglutathione. Which of the following enzymes improves GIT function? Pepsin. Which of the following enzyme has fibrinolytic activity? Urokinase. Which of the following enzyme is used in cancer therapy? L-asparginase. Which of the following statements concerning nutritional supplement are true? Nutritional supplements are intended to supplement the diet and bear or contain one or more of the following dietary ingredients, that is a vitamin, mineral, an herb or other botanical, an amino acid, a dietary substance from human use to supplement the diet by increasing the total daily intake, a concentrate such as meal replacement or energy bar, a metabolite, constituent or extract. Nutritional supplements are regulated as food and not as drugs. Nutritional supplements are not pre approved on their safety and efficacy, unlike drugs.